So I've got one here about, can weight loss medication be used by people with health conditions such as diabetes? Now, this is a really interesting one, isn't it, diabetes? Because there are two forms of diabetes, first of all. There's type 1 diabetes, which usually starts in childhood and is a condition where your body doesn't make the insulin, the hormone that's required to manage your blood sugar. So usually from a very young age, you go on medication such as injectable insulin itself that manages that for you. So weight loss medication as a whole, in terms of these types of medication, isn't suitable for those people with type 1 diabetes on an insulin, because, as I sort of briefly mentioned at the beginning, these drugs first came to market as a treatment for type 2 diabetes, which is the adult onset diabetes that generally comes usually as an issue where your body has been having to manage high sugar levels for such a long time that your body actually becomes insensitive to it, and your insulin, although it's being produced, isn't working properly, so you're getting high levels of sugar in your blood even though you shouldn't be. And obviously high sugar in the blood is bad, it's not good for your body, for your organs, so again, that's why it needs to be treated. So if you're taking an insulin type medication, which you can do sometimes with type 2 diabetes that hasn't responded, they don't advise you to take, or we don't advise you to take, a medication such as Wegovy or Mounjaro, because they also have an ability to have an effect on blood sugar. So if you're taking an insulin, which is driving your blood sugar, and you're taking one of these, there is a chance that your blood sugar could go too low and you could have what's called a hypoglycemic event, which can make you really poorly and unwell. Now, that being said, there are some specialized diabetes centers where somebody's managing your diabetes very closely that might be able to co-prescribe these, because they're able to really look at the minutiae of how your blood sugars respond to things. So that's not being said that this is an absolute definite no, but it's usually only if you've got that high level of care and somebody monitoring you effectively that you can go on that medication. But for the vast majority of people with type 2 diabetes, where the first line is actually diet and lifestyle changes anyway, going on to these types of medications can actually be really beneficial, because not only will it help you manage your weight and achieve your weight loss goals, but by its nature, sometimes losing weight and changing the environment within your body can actually help reverse the type 2 diabetes, and actually you can end up with with no longer having that diagnosis. And we see that a lot actually with patients that lose weight, whether they're using these medications or not, because you're changing what you're eating and how you're managing your body. Type 2 diabetes can be reversed and no longer an issue for you. So if you've got type 2 diabetes or you're not on an insulin type product, then do have an appointment with a doctor, talk it through, find out what medication that you're on. And actually, this losing weight and using these medications can actually be a really good adjunct to your diabetes care as a whole. And often, your practice nurse or whoever manages your diabetes will actually be really supportive of you taking this medication, because we know the beneficial effects it has on blood glucose anyway.